afternoon. This is Dr. Antherica Lane with the Cincinnati Medical Association. We're so glad to have Dr. Christopher Lewis with us today. Dr. Christopher Lewis is the Vice Provost for Academic Programming at the University of Cincinnati. He is also a family physician with UC Health. Good afternoon, Dr. Lewis.
Good afternoon, Dr. Lane, and thank you for having me.
We'll get started with our questions. The first question exactly is, what is coronavirus? And is coronavirus and COVID-19 the same thing?
I'll do my best to answer the question, but before I start, Dr. Lane, I'd also like to encourage everybody that might be watching or listening to this to also check out the CDC's website, cdc.gov, for the latest, most up-to-date information. It's a very valuable resource, and I'm on there virtually every day now just to, stay current with the news out there. Coronavirus is the same thing as COVID-19. It's a novel coronavirus, meaning there are many coronaviruses out there that we knew of, but this was one that is new that scientists and doctors weren't aware of until now. It's a respiratory illness that is caused by a virus, and it can be spread person to person. It was first identified during an outbreak, during an investigation into the outbreak that was happening in Wuhan, China.
So, Dr. Lewis, why is it called COVID-19?
COVID-19 is the acronym developed by the World Health Organization in February of 2020 to denote coronavirus disease of 2019, because 2019 is when it first came into play. So the CO stands for corona, the VI stands for virus, the D stands for disease, so you get COVID-19.
Thank you very much. So how exactly is the coronavirus or COVID-19 spread? How is it transmitted from person to person or even animal to person?
Well, it probably originated, Dr. Lane, from transmission from an animal to a person. People are proposing that might be how this virus came to be and came to infect human sources. From person to person, it's spread through respiratory droplets. Those are little droplets of fluid that are produced when someone coughs or sneezes. So if you have a person that's infected with coronavirus or COVID-19 and they cough or sneeze, they emit these tiny respiratory droplets that can then get into the air and get into someone else through their nose, mouth, or potentially even their eyes.
What are the symptoms, Dr. Lewis, of coronavirus? How will I know if I have the coronavirus?
The main three symptoms that healthcare professionals are looking for in patients are fever, cough, and shortness of breath. And typically it's a pretty high fever for people who are actively infected. And typically it's a pretty impressive cough. I'm sure that other viral-like symptoms can go with it, like myalgias, which stands for muscle aches, probably people feeling malaise or run down, fatigued. But cough, fever, and shortness of breath are the three main symptoms of COVID-19.
At this point, is there a cure for the coronavirus?
There is no cure, and my fingers are crossed and my prayers are going up that there will be a cure sometime soon. There are scientists working on a vaccine. The latest report you hear that we're probably 12 to 18 months away from a successful vaccine that people can take. There's also a lot of people working on drug treatments, antiviral medication that will fight this disease. So that work is ongoing, but nothing currently exists. You're really just trying to take care of patients' symptoms and keep them alive through supportive measures.
So what does it mean to flatten the curve? We hear this terminology often, and what does that really mean?
Flattening the curve basically means doing what you can through policies, procedures, and actions like social distancing to keep the curve of infected people relatively flat, meaning you're trying to prevent a situation where you end up having a whole lot of sick people at once that overwhelm the healthcare industry. And if you don't mind, I can actually show people a picture of what this might look like. So this image of the curve and what it means to flatten the curve is adapted from the CDC, and it was featured in the New York Times recently. But essentially what you're looking at is, in this red part, this is a curve of what disease progression looks like if you don't do anything. The dotted line is the healthcare system capacity. So what we're trying to do by flattening the curve is to keep the number of infected people below this threshold of where our healthcare system can take care of them. Over here in the red is what it looks like if you don't have any measures. And what you'll see is that peak goes way beyond this dotted line and overwhelms the healthcare capacity. By flattening the curve through um, uh, prevention, education, social distancing, and other measures, you end up with less people getting infected in a certain rate of time. So they're kind of spread out over time, and that leads to the peak of that curve not hitting the healthcare system capacity and not overwhelming healthcare providers.
So if we simply continue to practice social distancing, if we continue to even stay at home from work, if we continue to do those things and, as they say, mitigate this process, then we potentially could flatten the curve and prevent overwhelming the healthcare system.
And that's exactly what you're seeing in our home state of Ohio. We had a very aggressive leadership of our state that started social distancing practices and made recommendations about working from home very early, before we even had a whole lot of cases here in Ohio. And what we've seen as healthcare providers is that that surge that we've been anticipating hasn't come as quickly or as powerfully as we anticipated. So in Ohio, we are successfully flattening the curve, meaning those measures such as staying home when you're sick, number one, working remotely, social distancing, and all of the things that we're encouraging people to do that might have symptoms like cough or sneeze into a tissue and then discard that tissue. Now we're recommending that when you're out in public that you wear a mask, wiping down surfaces that are frequently contacted or that might have the virus on them. All of those things seem to be playing a role in Ohio and in our local Cincinnati Medical Association region of Greater Cincinnati. So here we have a graph posted on the Ohio Department of Health website that features research done at the Ohio State University that shows exactly how we're flattening the curve in the state of Ohio. Originally, with looking at modeling and forecasting, predictions were that there might be as many as 62,000 new cases a day of the coronavirus disease, and that would have put our graph looking very scary like this, and we would have certainly overwhelmed the capacity of our healthcare system. What's happened due to our social distancing, remote work, and all those other things that we're employing is that our curve looks much flatter, not this great peak, but over time it's been spread out so that the cases of new people aren't as high as we anticipated, and they're coming at a less quick rate than we anticipated. Now we're really looking at 2,000 or less new cases per day with these mitigation strategies. So you can see that curve looks very flat here compared to this whopping curve when things first started and the early projections.
So there are some questions that I'm sure a lot of people are asking in their minds. And the first one is it necessary to wear a mask and gloves in public if I do not have symptoms? And does it matter what type of mask I wear?
Now it is being recommended in Ohio that everybody going out in the public wear a mask. And this is for two reasons. Number one, to protect yourself from other people. But number two, to protect other people from you as well. Now, the type of mask, the different types of masks do offer different levels of protection. All the way from the N95 mask that people are talking about for use by healthcare providers, all the way down to a bandana that you might make into a mask at home. Studies do show that that even wearing a cloth mask that you might make at home is effective. It's not quite 100% like some of the other masks may be, but studies done on influenza and cloth masks show that they're generally about 30 to 50% effective. And in fact, those masks are going to be more effective at keeping your germs away from other people when you cough or sneeze than they are going to be in terms of you protecting yourself, but still better than nothing, and highly encouraged that everybody wear a mask when they're out in public at this point in time. Now, in regards to wearing gloves, gloves can help protect your hands from picking up the virus on surfaces. But one of the problems with the gloves can be is that if you're wearing gloves and are still touching your mouth, nose, or eyes, you're still doing the same thing as if you weren't wearing gloves. For me, what I see gloves being helpful in doing is for people who really have a tough time remembering to keep their hands away from their face. Sometimes wearing gloves can help be that constant reminder to them to not touch face, mouth, nose, and eyes. But certainly the importance of hand washing is one of the most crucial things that you can possibly do. Washing with warm soapy water for at least 20 seconds is recommended. If you don't have the ability to wash your hands, using hand sanitizer, and you want to specifically use hand sanitizer brands that say they kill 99.9% of germs to protect yourself.
There's a lot of talk, Dr. Lewis, about vulnerable populations. Who would you say are the vulnerable populations, those people who should be most concerned about contracting COVID-19?
Vulnerable populations, as defined by the Center for Disease Control, tend to be those people who are over 65. So adults over 65 are considered vulnerable and at higher risk for contracting and having significant problems if they contract COVID-19. You're also looking at people that have chronic medical conditions like heart disease, diabetes, severe obesity. You're also looking at people that have what's called an immunocompromised state. So people that, let's say, may be on cancer treatment, like chemotherapy, where the drugs and the treatment for the cancer reduces their body's ability to fight off diseases. Those people are considered at higher risk in a vulnerable population. People with immunodeficiency diseases like HIV, AIDS, people that have had a bone marrow transplant. All of those folks would fall under the vulnerable populations category.
There has been some talk about ministers in the communities, pastors who have refused to close their churches to worship services or large gatherings. What could you say to those leaders of congregations in regards to why it's important to close their doors at this time to large gatherings?
Really, what I would encourage church officials and leadership and pastors to think about is the health, well-being, and safety of their congregations. We're really talking about a disease that kills people. And some of us haven't had that experience yet of having a loved one die. I personally have had a person die last week from COVID-19. So it's real for me. And if it's not real for you yet, it will be. And you're just playing with fire to facilitate large gatherings of people where this virus can spread. Again, one of the most important things to note about COVID-19 is that you can actively spread the virus before you even know that you're sick, before you have symptoms. So if someone may be coming to church feeling A-okay and feeling like nothing is wrong with them, and meanwhile they're infected and infecting everybody that they're coming into contact with. So it is just not wise. Close your doors. Figure out a way to get your message, your sermon, your service to people other than having them come in person until all is clear from our government officials.
Why do you think African Americans are disproportionately affected by the coronavirus?
I think there are a few reasons why African Americans are disproportionately affected by coronavirus, and we're seeing that information come out loud and clear from cities like Detroit, Milwaukee, Chicago. We don't have any racial demographic data yet in the state of Ohio, but I'm sure it will probably point to the same sorts of issues with African Americans being disproportionately affected. Number one, I think underlying health conditions may put African Americans into that vulnerable category more so than their Caucasian counterparts. So more of us have heart disease, kidney disease, diabetes, obesity, and some of those other health conditions that make you more vulnerable to the virus if you do get it. I think the second thing to note is what doctors call the social determinants of health. So, when you're going through medical school, you learn about medicine and drugs and disease and things like that. But you also learn about the things in society that impact people's level of healthcare. So education, housing, employment, access to clean water, those sorts of things play more of a role than people might understand. And unfortunately, in 2020, African Americans still are at higher risk for having some of those social disparities of health to play a role in their overall health. When you're living in an apartment building and don't necessarily have access to a backyard to have the kids go run around in, free from touching and being close to other kids, and you have to think and be more strategic about where can your kids play, where can you go, what space can you be in. It creates a challenge. A lot of our people are in jobs where it's not as easy or maybe impossible to actually work remotely. We have a lot of people that are in the labor industry, in blue collar jobs, bus drivers and things like that. Hats off to them. I consider those people on the front lines as well. Your environmental services people, it's hard to do that sort of work remotely. You know, I
Mm.
have the good fortune of being able to do telehealth with my patients, and my duties at the university I can do at home, sitting, you know, at home with the kids running around, and I'm on the computer. But a lot of our people don't have that luxury of being able to work remotely, and they have to go into work, and thus they're more susceptible to catching this virus. But all of those social factors beyond just healthcare can play a role. Well, when we talk about COVID-19 having a bigger impact in African American communities than other communities, I am delighted to be a member of the Cincinnati Medical Association, because I think part of the way we can fix that is through education, through healthcare providers that look like our people and that are culturally competent and know how to be trusted members of the community efforts to educate people, inform people, and hopefully encourage people to do what they need to do to protect themselves. And the Cincinnati Medical Association is doing that. We're taking part in the video campaigns, the radio campaigns. We'll be on Lincoln Ware's show tomorrow. You know, we're just out there visible in the community and doing our part to educate people, and a lot of us are on the front lines taking care of patients as well. So it's just a fantastic organization. I've been a proud member for many, many years, and hats off to all the CMA doctors that are on the front lines and really working hard to protect our community.
Thank you so much. And I know that University of Cincinnati is a huge leader in healthcare here in this area. What is UC doing for this fight?
UC Health, which is the healthcare delivery arm of the university, is very active in the COVID-19 fight. There you're talking about, you know, level 1 trauma center. We have the emergency room. Our UC emergency docs, they invented the concept of emergency medicine and have the oldest residency and most prestigious residency program in the country. Those folks are fighting the fight for all of us. They are on the front lines. They are risking, in lots of cases, they're risking their own health and well-being to take care of our community. We have drive-by testing. We are seeing a high percentage of patients with COVID-19. We're the city's biggest player when it comes to taking care of our urban core and our African American community members. So we care, we're doing our part, and we hope that you do your part too by social distancing and taking care of yourself.
Well, thank you so much, Dr. Lewis. This is Dr. Antherica Lane coming from the Cincinnati Medical Association.
Thank you.